I met Lacey through Kathy Humphrey initially, right, Lacey?
That's
At
right.
at Claremont Crest, and that's been pre-COVID. And so we had, at the time, I didn't see the connection for Lacey coming to Central DeKalb. And of course, COVID's taught us all a whole bunch. And one of the things I've learned is that we can partner and we should partner and we need to partner with Lacey to make sure that everybody has the information to get the help that they need. Because the one thing we on physical therapy is so important to I'd say all of our members. And where do you go? Who can you trust? Who can really produce benefits? Who will pay you the attention that you need and will listen to you? And it has been during COVID that I've gotten a very clear picture of the work that you do. And so I'm grateful for that. So anyway, thank you, Lacey, for coming today to do this program. This is not what none of us really ever wanted to do all the time, but I appreciate you being here today for us at Central DeKalb. And I hope that one day soon you'll be here in person. So I'm going to turn it over to you. As I see more and more people show up, this is the way it is. So anyway, thank you, Lacey. And is there anything we can do for you right now? Are you good?
I think I'm good, Victoria. I do see the option to share my screen, so I think we're good to go. If I have any issues with that, I'll let you know.
All right, perfect. So thank you. I'm going to turn it over to you, Lacey.
Wonderful. Well, I see a couple familiar faces, so thank you hi, Donna. Thank you to all of you that hopped on. A lot of you, if you have met me over the last 2.5 years, have probably heard my spiel about therapy. Obviously, I'm very passionate about it and I love to talk about it. So I'm really excited to share with you a little bit more about legacy and just some of the benefits. Because we do get a lot of questions about, well, what is physical therapy or occupational therapy? How does it differ from just a typical exercise class? What are the benefits of doing therapy as opposed to taking part in exercise class? So those are some of the things that we'll go over today, as well as just a broad overview of what can fitness do for us, what are the implications of having a fitness program that you're a part of as an older adult, as a senior. What are some of the benefits for our cognition, our circulation, our bodies? And there are many. And then I'll just share a little bit about Legacy's mission, why we do what we do, where we came from, and all of that. So a little bit about me. I'm from Orlando, Florida. I moved to Georgia over 10 years ago now. I graduated from Wesleyan College in Macon, and I went to physical therapy school at Mercer University here in Atlanta, right down the street, really. So it's always been nice to be close and keep that connection, since we're able to collaborate with a lot of the professors, and therapists are able to come in that are graduates and train the students or take part in interviews. So I love being close by. I'll share my screen here in a little bit, but I always knew I wanted to be a geriatric physical therapist. That's something that's been really near and close to my heart since I was in high school. Had a really close friend whose mom worked in nursing homes, assisted living, and she was the executive director of these buildings. So I got a lot of exposure early on, and just really felt like this was the area that I wanted to be in. And as I started to intern in college before going to physical therapy school, I spent a lot of my time interning in nursing homes with physical therapists. And I think one of my big light bulb moments was my first day interning, and the physical therapist I was working with helped this fellow who had had a recent fall and had a stroke stand up in the parallel bars. And his wife was there with him, just cheering him on in therapy. And she stood at the other end of the parallel bars, and she was like, walk to me, I mean, just like you did on our wedding day. And he stood up and he walked, and that was the first time he walked in a month and a half. And it was just a very heartfelt moment. Still kind of brings tears to my eyes because it was very beautiful. And really just drove home to me the impactful meaning of our work. I do feel very passionate about the senior age group, I do feel like this is an area where a lot of healthcare professionals forget to devote a lot of energy and excellence to our older patients. And so I think it's very important as a physical therapist that we are striving to be excellent for patients across the age group, but especially our seniors, because all of you deserve excellent therapy. You deserve a good quality of life, and you deserve healthcare professionals that are going to listen to you and are going to work with you and take that evidence-based medicine and apply it to you just as we would for anybody else that is any other age. So with that being said, we'll go ahead and I'll share my screen here. Let's start it. I think I can just go right to the PowerPoint right here. Let's try that. Okay. Okay, perfect. So I'm going to try to hopefully do this without any hiccups, but we'll just kind of dive right in. Does that look okay, Victoria? Oh, I think you're muted. Okay. All right. So we already.
All good.
Oh, that looks okay. Perfect. All right.
It looks good.
Okay. So here's our little flask picture here. As I already told you, I'm a graduate from Mercer University. Go Bears. We have a doctorate in physical therapy to practice as of the mid-2000s. So any therapist that you see from 2010 onward is typically going to have that doctorate level degree. So basically what that means for you is we do get a lot of training across the age groups, and we're very trained to take into consideration your medical condition so that we're appropriately dosing exercise for you. So exercise that is safe despite you having medical conditions. A lot of people are concerned about starting exercise and they think, well, I can't because I have back pain or I have a heart condition, but it can be done appropriately. You just have to make sure that you are working with somebody that has training to understand that and kind of work with you. I liked Mercer's program because it is very unique for its service learning model. What that means is we have volunteer experiences integrated into the curriculum. So we spent a lot of time working with children who were special needs. There are a couple of really great foundations across Atlanta, but they have volunteer healthcare professionals provide basically respites for parents. You can drop your kid off for the day, and healthcare professionals will essentially host a really fun day for your kids, and these moms or dads can have a little bit of time to themselves. We also did basketball with individuals with Parkinson's disease and boxing courses as well. Boxing has been shown to be very beneficial in this particular population. So there are a lot of really unique experiences that were really fun. We've got some experience in skilled nursing care, nursing homes across Atlanta, the hospital, a little bit of wound care, and then outpatient therapy. And I've got special interests, of course, in geriatric rehabilitation as well as diabetes management. And I've been with Legacy for 2.5 years. Now, Legacy is a really unique therapy model. This is a model that I wasn't familiar with until about 3 years ago. So basically, we are outpatient therapy providers. We work through your Medicare Part B benefits, not your Medicare Part A, your hospital benefits. So even though we work within the home, we bill as outpatient. This is really nice because it gives us a lot of flexibility with you. You get a lot of say-so in how often you'd like to come to therapy, how long we can see you. Really, it's very nice for residents who want a little bit more hands-on therapy and maybe want a little bit more time with their therapist. A lot of times with home health, you are limited by a specific amount of time and days per week. So Legacy was started in 1999 by an occupational therapist, and she saw that need in senior living communities for on-site rehabilitation. And it is really nice because we're in your home. You can come to the gym if you like, but we're also able to come to you. So very flexible in that perspective. And for over 20 years, Legacy has been a therapist-owned corporation, and we're in over 12 states. And we'll get into kind of our not-for-profit work a little bit in just a moment. So being therapist owned, we're very, very keen on making sure we've got excellent documentation. We are providing skilled therapy to residents. So Legacy is really devoted to continuing education for its therapists and establishing consistent programs for residents. We'll get into some of the programs that we offer. We offer physical and occupational therapy, primarily in our independent living facilities, or for many of our more independent individuals. Yes, we can see individuals that are not members of the senior living community. You can come from the outside as well. There's no requirement for that. Typically, we're just going to offer physical and occupational therapy in those more independent settings. Legacy is in assisted living and memory care facilities as well as nursing homes. And so we offer speech therapy in some of those settings that are a little bit more involved, usually in our buildings with more independent individuals. Not a lot of people need speech therapy, so many tend to refer out, though sometimes we are able to, if we have enough individuals on caseload that need speech therapy, we are able to have a speech therapist come in. So in 2018, Legacy was acquired by Deaconess Association. So this is where we really get into the not-for-profit aspect of this company. Deaconess is an association that provides healthcare opportunities to those in need. This has been a really positive transition for Legacy. Legacy has always been very dedicated to providing therapy for individuals in need. But being part of Deaconess's charitable mission, we're able to really, we're able to partner with them to really kind of increase our reach and make sure that we are reaching more individuals that need therapy. I love the not-for-profit aspect of Legacy. It is a very big passion for me, just because as we have seen in the last couple of years, really, there are a lot more insurance restrictions. There are a lot of individuals with insurance plans or no insurance who find affording therapy very difficult. Healthcare in America is very complex, as we all know. And a lot of individuals do struggle with getting care that would really benefit them to change their lives simply because there's a copay or they're not adequately covered. I would love that for that to not be the case. However, unfortunately, that is the case for many of the individuals that we see. And we do oftentimes see that closer to the heart of the city in Atlanta as well. So this mission is really important to me because we are able to offer financial assistance to a lot of our residents or community members that need therapy. And a lot of times we're able to waive copays or provide therapy services very low cost or free of cost. The financial assistance program is very unique to each individual. It is a case-by-case basis, but it is a huge part of our mission. I can definitely say we have about 30% of our residents on caseload on a financial assist program at least. So we are able to help a very large amount of individuals on our caseload who need therapy services, and it's made a big impact. So we're still therapist operated. Our CEO is a physical therapist as well. Legacy is continuing to expand. We're even as far out as Arizona, Florida, North Carolina, South Carolina, so all over. Despite COVID, we've still been able to expand, and we are growing our reach into a lot of new and existing independent assisted living facilities. We're in the charter buildings, the Baptist retirement buildings, of course, holiday buildings that were recently acquired by Atria, and Hawthorne buildings, as well as several others. Our logo was changed just recently, just bringing it back to our ties with our not-for-profit company. The cross in the middle of the logo is a nod to Deaconess, really playing off of that not-for-profit. And the torch represents empowering individuals, so empowering you, your legacy, and the lives of seniors who we're able to uplift and strengthen through our work with you. And RY, our CEO at a meeting was recently telling us that he typically will hand out a business card with this logo on it. So when people ask, oh, what do you do? He said, this is why we do it. And that's been that's gone over very well with individuals. So our catchphrase, our why for doing what we do, of course, is that senior adults should live a life filled with purpose, safety, and dignity. Just like we talked about before, everybody deserves excellent therapy and excellent quality of life. And there really shouldn't be any change in your care across the age span. So a little bit about our mission, of course. We've already gotten into this somewhat, but I'm going to go ahead and elaborate a little bit. We want to improve the health of senior adults so that they can live the way that they want to through wellness, education, safety, rehabilitation, caring. Our values. We want to be honest and transparent in all of our dealings, provide that evidence-based clinical excellence. So that is our mission, to really have great clinical programs, continuing education for our therapists so that we're providing you care that's at the top of our licenses. We want to discover and innovate to change the lives of those with whom we interact. And of course, treat everyone with respect and dignity. That's a given. So as we already talked about, our model is in the home or in communities where seniors live. We want to help you gracefully age in place. And we want to make it as easy and convenient for you as possible. We offer free weekly exercise classes within our communities, and we also offer free education opportunities, health talks, and social events monthly within our communities. And that's part of our service model. We want to be able to reach as many people as possible, regardless of financial or life circumstances. So a little bit about all of the different therapies. There's a lot of confusion between physical and occupational therapy sometimes, and I spend a good bit of time explaining to people what are the differences. I was once given a very good metaphor by a mentor. I said physical therapy, we have a table with a plate of food on it. Physical therapists help you walk to the table and sit down. Occupational therapists help you cut up your food and take the fork and bring it to your mouth. And speech therapists help you swallow, of course. So looking at it from that perspective, physical therapy focuses a lot on big picture. We want to re-educate your muscles, retrain parts of the body, and we want to tie it into function. So yes, we might do bicep curls. But why are we doing it? Is it so that you can lift grocery bags? Is it so that you can pull open or pull shut a door? Are we working on standing up and sitting down because you have difficulty getting in and out of the car? So we always want to tie it into a function. What specifically are you having difficulty with, and how can we strengthen, address your pain to make sure that that is easier for you? Sometimes that means that we might recommend equipment for you or recommend ways to compensate for weakness. If you've had a stroke, for instance, you might be very weak on your left side. We can work on strengthening on that side, but you may also need some equipment, technology, or some strategies to compensate and move better despite weakness on that left side. So physical therapy combines manual treatment, so hands-on. We utilize massage, joint mobilization, pain management techniques. We utilize modalities, ultrasound, electrical stimulation. So if you've ever used a TENS unit, that's very similar, to help reduce pain. We look at the mobility of your joints. For instance, is your shoulder able to move where it should? Is your hip able to move how it should? And we look at the strength of those muscles that are around that joint. We re-educate muscles. We help to address certain muscle groups that are going to help get you to that functional level. And by doing that, we improve your mobility, strength, endurance, and balance. And we're going to tailor fit that to you. So a resident might come in with difficulty feeling anything in their feet at all. So what are we going to do to troubleshoot making your balance better when you can't feel anything in your feet? So those are the kind of things that we look at, and we specifically design interventions for you to make sure that that exercise is going to be effective. effective and beneficial for you. So as we talked about 2 slides back, really, it's that big picture movement. We'll work with your coordination as well. One of the things I really specifically enjoy working with my senior clients is some of those harder things that you wouldn't expect somebody to work on with you. So can you do deadlifts? Can you do squats? Why would I ever have anybody over 65 do deadlifts? Well, you have to bend down and you have to lift up laundry, or you have to pick up grocery bags or suitcases. So if you're squatting, why wouldn't we add weights if it's safe and effective for you? I like working on a lot of things such as hopping, for instance, jumping, stomping. This has been shown to improve bone density, which is really important for osteoporosis, especially in a lot of our clients who are older women who may struggle with decreased bone density and frailty that may make you more prone to fractures. And then we'll also work on dual tasking. What that means is doing more than one thing at once. We know through research as we get older, it's difficult to multitask. You've probably seen many of your colleagues or friends who possibly have difficulty doing something such as talking and walking at the same time. And my grandmother has difficulties with this. It is possible to train the brain so that you are able to more effectively do 2 things at one time, or maybe more. And this has been shown to decrease risk for falls, because in a normal world setting where you are trying to keep your balance, but you're in a grocery store, somebody might bump into you, or you may have somebody stop suddenly in front of you. You may be looking for something and not able to always look right in front of you. So you're constantly distracted in the real world. So why wouldn't we train you to be able to do more than one thing, or be able to have good balance with distraction, if that's going to be what you're going to encounter in the real world? So those are some of the things that we think about that are unique to some of our older clients. It's not simply sticking you on a foam pad or having you do some weights. We really want to make sure that it's something you can apply to your normal day-to-day life that's really going to help you. And this slide is basically everything that I just talked about with you. Another caveat to that is we do work with individuals with varied cognitive levels. So cognition ties into various abilities such as short-term memory, long-term memory. As a resident we're working with have confusion. So we do have to tailor plans around cognition as well in this population. It's something we can't get around. So a lot of times we will do cognitive screens on residents. Our occupational therapists, a lot of times you're going to take the head of that. But we will be keeping that in mind as we're planning a treatment plan for a resident. So just a little bit of a highlight of some of the things that physical therapy does. We work on reducing fall risk. And with that being said, we also work on fall recovery. So can you get on and off the ground safely? That's a really big one. A lot of the training I've done with residents has ensured that they're able to get up if they fall. We never want you to fall, but you never want to be in that position where you can't get back up. So it is very important to practice it. Obviously, we're going to work on movement. We are the movement specialists. We assess how you move, assess better ways to move. And we're going to improve your strength, your balance, your stability to make sure that you're able to move better. We want to work on maintaining skin integrity. Through that, we might recommend various kinds of footwear. Physical therapists can work with individuals with wounds, but then we also prevent that mobility that is going to be better for skin integrity. Obviously, we reduce pain. And 2 of the really big ones people aren't aware that physical therapists work on are inner ear issues. So vertigo and vestibular issues. Inner ear issues are very common in the older adult. If you've ever had a lot of dizziness when you're rolling over in bed, you probably know what I mean. A lot of times that is treatable with just a few sessions from the therapist. And then we can also work on incontinence. If you're having difficulty getting to the bathroom, you're having to use different pads or different products for incontinence, or you're having accidents, a lot of times pelvic floor retraining can be very beneficial. So moving on to OT, we have a really great team of occupational therapists. And I think occupational therapy is an incredibly versatile field. I am constantly amazed at the occupational therapists on my team who are able to come up with really unique ways to adapt to clients' needs. So occupational therapists, there's the very, I suppose, big belief that occupational therapists just work from the chest up and just work on arms. That's not necessarily the case. So a lot of times we'll see that in nursing homes. Physical therapists will work on the lower body. Occupational therapists will work on the upper body. There's much more to it than that. Occupational therapy is all about maximizing your ability to perform activities of daily living. So that might mean helping a caregiver know the appropriate ways to cue somebody to help them get dressed if they have dementia. That might mean that you really want to be able to walk your dog, but you haven't been able to. So how are we going to get you to a safe level where you can walk your dog? Maybe you have a lot of trouble cooking because it's hard to get around in your kitchen, or you're not able to take a bath, or you're not able to do your laundry without a lot of assistance. Occupational therapy can help with that. It's all about maximizing your ability to do your day-to-day tasks. So occupational therapists are specifically working with seniors to maintain those skills needed to help you remain independent in your day-to-day life. That doesn't just mean the basics such as getting dressed, brushing your teeth, taking a shower, making your bed. That also applies to finances. That applies to calling doctors and scheduling appointments. That applies to driving. A lot of those higher level activities that require a lot of independence and take into account cognition. And I think occupational therapists are really incredible at doing that because they really do look at the whole picture. It can also include managing medication, continence management as well. So working with bladder, pelvic floor muscle retraining, and of course, pet care, as we already mentioned. Occupational therapists can also work with residents with low vision. For clients with low vision, they can help with adaptive techniques to make your environment safer, such as using different lighting, contrast, magnifying, to help clients remain as independent as possible despite low vision. They can recommend different kinds of adaptive equipment, such as telephones with really big buttons or voice-activated medication dispensers. So it really is amazing what kind of technology is available to help when you've got the right recommendations from a trained professional. And it's all about your quality of life. So still tying it back to that cognitive function. Not every client we work with is going to have cognitive impairments, but again, I think it's very important that we're taking that into consideration if we are working with somebody, because it is going to impact your ability to be trained on something or really take away something meaningful from the therapy that you're receiving. So just a quick summary of what occupational therapists can do. They can work on community reintegration and mobility, your ability to get out in the community, go to the park, go to the doctor's office, go grocery shopping. A lot of our occupational therapists will accompany residents to the grocery store, for instance, or will do those challenging tasks that a lot of clients have difficulty with, such as doing that laundry or cooking a meal, which is really fun. They can provide driver safety assessments, restore upper extremity strength, your gross and your fine motor coordination, such as in your fingers. Occupational therapists can work on hand function. If you've got a lot of arthritis in your hands or your shoulder, it's a great idea to see an occupational therapist. They can work on splinting, so using different devices to regain range of motion in your joints. Of course, help with that incontinence, as we talked about. And just to help seniors be as engaged as possible in their home and their community while working on different perceptual and cognitive skills. So your ability to process something, your ability to utilize different techniques to complete something, your executive function. So if you're going to go to the bank, that ability to break down, well, what do I need to put in my purse to go? Do I need to call somebody to take me to the bank, or can I drive myself there? How much do I need to take out? Everything has a series of steps that you need to do and able to do it. And if somebody has difficulty with executive function, that ability to sequence from one step to the other, what to do, that can cause a lot of issues in day-to-day life and being independent. And then a couple more asides. We've already talked about the shopping, the laundry, of course. Various adaptive equipment can be recommended by occupational therapists. So devices to make it easier to put your shoes on, to pull your pants on, to button things. Devices that can make it easier to use utensils such as spoons and forks. Devices that make medication management easier. And we already talked a little bit about those visual impairments. And then we also can assess your home. Is your home safe? Are you at a risk for falling because of the way that your home is set up? I love doing home assessments. We can take a look at, do you have cords on the ground or throw rugs? Various things such as that, that could possibly cause you to trip and fall. And I would recommend, if you've never gotten a home safety assessment from a therapist, we do offer free home safety assessments. Definitely take us up on that. Sometimes you would be amazed at the small things you can change to really lessen your risk for falls within the home. A lot of us have a lot of clutter, and clutter can definitely lead to falls. It's one of the easiest things you can change to make sure that you're safer. So we offer a lot of different therapy programs. Our clinical programs are a result of the training that we give all of our therapists to make sure that we are providing skilled treatment for our residents. So some of those are our balance program, our safety and motion program, our low vision program, our cardiovascular progressive exercise programs. So all of those have a specific protocol that oftentimes we'll go by or reference to make sure that we're progressing you in a very skilled and effective way. So some of those, as mentioned, we've got a vestibular program. So if you've got a lot of trouble with that dizziness, maybe you have something called EPPD. It's very common in a lot of women over 65, just because our inner ears have cells that oftentimes break down. And when you've got these crystals that start floating in your ear, it can cause a lot of dizziness. A lot of times that's not the only thing at play with vestibular rehab, but we can address a variety of things along that spectrum. And we have a low vision program, oftentimes put into place by our occupational therapist. Cardiopulmonary program. So if you've had cardiac surgery or cardiologist has recommended therapy to you, or you're just having a lot of trouble with shortness of breath or doing all of your day-to-day tasks because you're very tired, the cardiopulmonary program is a really good one for our residents. Medication management. So if you are just drowning in pills and you feel like you have a lot of trouble figuring out when to take what, maybe it's really hard for you to organize your pill box because you have to take multiple pills at different times of the day. An occupational therapist can be extremely helpful in making sure that we manage that in a safe and effective way for you. We address Parkinson's, and I would say that most individuals with Parkinson's should regularly follow up with a therapist. It is extremely beneficial and helps prevent decline. We have a cognition program for individuals with Alzheimer's or dementia. Continence management, of course. Safety and motion, our falls prevention program. And then chronic condition management. So that might mean chronic pain or diabetes, congestive heart failure, conditions such as that make it really hard for you to do your day-to-day activities. A physical therapist can really help, or an occupational therapist can really help. So when might you need therapy? You might need therapy if you are short of breath doing day-to-day activities, you've got difficulty walking, you have pain, that is oftentimes a huge one. If you're avoiding stairs or curbs because it's really hard for you to do them or you're worried that you're going to fall. If you've had a recent fall, especially if you've been injured, but even if it was a fall that has made you much more fearful of falling again. You might need therapy after surgery. You see a lot of residents post-rotator cuff, total knee replacement, total shoulder, total hip, various different kinds of surgery. If you find you're standing or leaning on things for more support, you have difficulty lifting things, or you have confusion or forgetfulness that's impacting your ability to perform day-to-day activities. A couple other things here. If you've got a lot of dizziness when you're sitting or standing, go see your doctor, of course, but a physical therapist oftentimes can help figure out why that's happening and strategies to stop it. Whether it's vertigo or something different, it might be medication related or related to something else. If you're having frequent trips to the bathroom or accidents, if you have trouble standing for a long time, Or maybe you started using a walker or a cane recently, or it's hard for you to walk and talk. There's a lot of other reasons you might need therapy. I do get a lot of questions sometimes about, well, what's the point? If I'm 90 years old, why do I need therapy? I'm just going to get old anyways. A lot of people tell me that. Your quality of life is important regardless of what age you are. Maintain that quality of life, maintain that ability to stay independent. I have worked in nursing homes and hospitals, and truly, it is such meaningful work to me to help residents age in place in their home and to stay here and be the healthiest version of themselves. Whether you're 97 or 60 or 50, younger than that or older than that, it really makes a difference regardless of your age. You should be able to maintain your independence and your dignity as much as possible. And that is meaningful. So why should you do a fitness program? Therapy aside, there's a lot of really big benefits. We'll go through this very quickly and we'll wrap up soon so we have time for questions. But a fitness program is beneficial for a variety of reasons. It's going to help prevent some common diseases, and it improves your immune function. So it boosts your immunity, it makes you less likely to get sick. It boosts your mood. It produces endorphins, which make you feel good, and it can help you sleep better, which is a really big benefit if you have difficulty sleeping. It helps improve our circadian rhythm and our sleep schedules. It improves your quality of life, decreases your fall risk, and improves your cognitive function. So a couple quick points here. Exercise truly is life-changing for seniors. It can help prevent bone loss. So we know that both men and women lose bone density as they age. That's why a lot of older adults are prone to fractures when they fall. Women can lose up to 2% per year. That is a lot. The strength training has been shown to counteract that, even in individuals older than age 20. So starting from a very young age, that means I should be doing a strengthening program and a fitness program to help my bone density. Having those stronger bones is going to help reduce your risk of fractures, and it's going to help aid in your balance. That's going to help you live independently and more safely with a decreased chance of going to the hospital in the event of any fall. And exercise can help arthritic pain. I have a lot of clients tell me, well, I'm afraid to do exercise because I have arthritis. I'm going to make it worse. But that's very much not the case. According to research, specific exercises, arthritis-friendly exercises, including that low-impact cardiovascular activity, strength training, and range of motion, can actually help take pressure off of those aching joints, and it strengthens the surrounding muscles. It also improves joint lubrication, which is going to help lessen pain and decrease stiffness. I oftentimes tell my residents with arthritis, your joints are kind of like gears in a bicycle. And if you don't use them and you stick that bike out in the garage, those gears are going to get really rusty and it's going to be hard to move them. The more that you move them, the better they move. The more lubricated they are, the easier it is to move, and they're not going to catch as much. Your bones are very much the same. So exercise is still very important despite having arthritis. And a lot of times it's going to help. I had a resident recently call me and let me know that her x-rays are the exact same from 2 years ago when she got the x-rays of her knee to now. She has not had to get any corticosteroid injections. She has not had any progression of her arthritis because she has been taking part in the strengthening program with me to specifically work on that knee strengthening. And that's really meaningful. She hasn't had to get a total knee replacement yet because of the exercise she's been doing. Exercise can help prevent some chronic diseases. This doesn't necessarily mean you're not going to have any diseases if you exercise. And this doesn't mean you shouldn't exercise if you have common diseases. But we have seen some positive benefits and some decreased risk for conditions such as hypertension, obesity, colon cancer even, diabetes, and cardiovascular disease. And physical activity can help minimize symptoms if you do have a chronic condition. We've also found that it can really reduce cognitive decline. So a study from the American Psychological Association found that participants over the age of 60 showed fewer Alzheimer's disease biomarkers just through performing 30 minutes of exercise per day. That's extremely meaningful. As we talked about a little bit earlier, exercise can help to boost that immune health. So we do find that based on studies of individuals that do take place in that exercise 30 minutes a day, they reported fewer acute respiratory illnesses and fewer sick days. We do know that exercise can really help boost your immune system, which can help keep you safer from COVID as well. We don't know the exact mechanism through how that works, but we have seen a very meaningful change and decreased sickness in individuals that do exercise regularly. It makes you feel good. So a lot of studies have focused around seeing the effects of exercise and how they can help ease anxiety and depression through that endorphin release. Exercise can also help you connect with other individuals, which is going to counteract some of that loneliness, especially from COVID. I've seen this really come into play during COVID when a lot of us were in quarantine. Exercise sometimes is at 1 or 2 opportunities per week for individuals to connect with somebody else. And to take place in some meaningful social interactions, which can be really beneficial and also help reduce cognitive decline. And then, is it safe to exercise? I do get this question a lot. Most older adults, so 65 and up, can exercise safely even with chronic conditions. There are a couple things we'll ask to screen you just to make sure that you're safe to begin. And we do want an order from your doctor prior to starting therapy, to make sure that the doctor's signing off on that and that we're all on the same page. You can talk with your doctor if you've got any specific questions about your condition, or ask a physical therapist or an occupational therapist what they think. But for the most part, absolutely, almost every single individual can exercise. Sometimes we even treat clients on hospice. Even though you might be on hospice, therapy can be really beneficial to, again, maintain that quality of life. So truly, across the age spectrum and condition spectrum, exercise can be beneficial for you. So whenever you're considering an exercise program, just a couple things to keep in mind. You want to combine that aerobic activity, strength training, and flexibility, that's stretching. Don't be afraid to weight lift. It can be done safely, and it is going to help with that bone health. And then those slightly higher impact exercises, such as stomping, those can actually be very beneficial and also stimulate bone health. And then if you're unsure, of course, ask a professional or give us a call, and we can definitely point you in the right direction for a program that might be good for you. Just a couple of interesting statistics here. 4,000 steps per day is very meaningful. It can actually decrease your risk of getting Alzheimer's. So if you take away nothing from this, try to walk every day. It truly has a huge impact on your memory. So tying it back into cognition, those moderate daily walks are going to improve your attention and improve your mental skills, going to lessen your risk for dementia, and it may slow the progression of cognitive decline or dementia if you already have it. Overall exercise in general is going to help improve your brain thickness, and that's going to help preserve your memory. So that's kind of what's happening when you are exercising and walking. It's going to help your processing speed, so faster reaction times, your executive functioning, which is your brain's ability to walk you through the various steps that you need to do something. And lower physical activity is correlated to thinner brain structures and poor cognitive functioning. So exercise is very important, especially as we are older. I would argue even more important when you're older than when you're younger. So it should be done throughout the age span. And then why might you need therapy versus an exercise program? Therapy is going to help work on certain musculoskeletal conditions prior to starting exercise. So basically, if you have low back pain and you really can't participate in a lot of exercise classes, see a therapist. We can help get that back pain or that hip pain to a level that is tolerable so that you can start working out in an exercise program, perhaps on your own. Maybe you're really afraid of falling. It's very beneficial to see a therapist so that we can work on your safety and some strategies to help keep you from falling. That way you are safer to participate in your own exercise program. Maybe you're not sure where to start. Maybe you have a lot of different health conditions. Very beneficial to see a professional. That way we can work with you and make sure that you're starting at a safe place. but also a place that's going to be beneficial for you. You do want to make sure when you're doing an exercise program that you feel like you're doing some work. If you're doing exercise and you feel like it's very easy, unfortunately, a lot of times you may need to do something that's a little bit more challenging for you in order to actually promote strengthening benefits and endurance benefits and all of those various benefits. That doesn't mean it's not okay to do an exercise program that's easy for you, but it does mean you want to incorporate exercises that are going to challenge you. And if you're unsure of where to start with that, that's another reason to talk to a therapist. We're going to consistently progress your program, ask you how you're doing, give you home exercise programs, and tailor it for you so that way you're consistently progressing and making sure that those exercises are in a level that are appropriate for you. Okay, so final points. Therapy is covered by most insurance plans, as I talked about a little earlier. We go through your Medicare Part B benefits, so most individuals are able to receive therapy. Typically, you just need a doctor's order to get started. And once again, we're trained to address a variety of diagnoses and offer those one-on-one services that are going to custom fit to your needs. And that's about it. This is our website, in case you would like to check us out. And if you have any questions, I am happy to take them now.
How do we get in touch with you to make an appointment?
Absolutely. So we've got our phone number and email address, and I actually should have put it on here. That would have been a great idea. However, I will type it in the chat box so that you're able to give us a call.
Okay.
We are located in a couple different facilities around Decatur. We're at Regency House and Claremont Crest. So again, you don't have to be a resident of either of those to receive therapy. The nice thing with us is we're always going to be one-on-one. So we're never going to be treating another patient while you're working with us. And typically it's going to be the same for you. You just need a doctor's order to get started. I'm going to go ahead and type our phone number into the chat box. So if you pull that up, we will be able to give our office a call.
Great.
And then our email as well.
You're at Claremont Crest, you said?
We're at Claremont Crest. Yep. Oops. Sorry. And that was actually the wrong email. Well, I'm putting the correct one below. I just recently changed my email. So in my mind, I was combining the two. So you'll be able to send an email or call that way.
Okay.
And then I will put my cell as well, since I am in between a couple of different buildings.
Okay, cell number.
And I'll put that in parentheses. And then another one of our office numbers as well. And that's a lot of information. So hopefully that's not too confusing, but that should be everything.
Okay, Mason 876. How long are your sessions?
They're going to vary. Sometimes they are going to be dictated by insurance, unfortunately. No session will ever be less than 30 minutes. So typically you're going to get at least 30 minutes with us. And typically that's the least amount of time, or sorry, that is, I wouldn't want to go any lower than that. It's
Right.
not really going to feel like you're getting any benefit out of that. They can go up to 75 minutes, but most typically 45 to 60 minutes is going to be the average for most individuals. It's going to depend on your tolerance and what you need, but that's a safe estimate.
Okay. And you said Medicare will cover this?
Yes. So obviously we take Medicare, we go through Part B. We are in network with a lot of Medicare Advantage plans.
Uh-huh.
So we'll run your insurance prior to beginning. That way you know fully what's covered. Of course, it's an estimate, but you're going to get a fairly accurate idea of what is covered.
Okay.
and our billing department will do that, and then we're able to get you started. Some
Okay.
individuals have power of attorney, like medical power of attorney, so we may need to get some documents from your medical power of attorney. They just may need to sign off on some things. But if
Mhm.
you sign your own medical documents, that's not a problem. And if you do have a medical power of attorney, that's absolutely fine. That is very much the case with a lot of individuals. The
Right.
prefix on the cell number is 404, or sorry, 407, and I will type that below. I'm from Orlando, so I still have an Orlando area code.
When you say doctor's orders, does that include like x-rays or MRIs or something that you would know exactly what the issue is?
So getting x-rays or MRIs or imaging is very beneficial. Typically, you're going to have that hopefully explained to you by whoever read the x-ray, whether that's your orthopedic or your primary doctor. The actual x-ray or the MRI is not a doctor's order, but the doctor oftentimes will opt to send that with your doctor's order. So for instance, if you had a fracture of your shoulder, it's very nice to have that imaging to see what that fracture looks like. So it's a nice to have, but not a need to have. We mainly need that order from your doctor for outpatient physical or occupational therapy so that we can begin. A lot of times that doctor will just want to make sure that, obviously your regular patient affairs. It can be a specialist if you see them regularly, so a neurologist or an orthopedist, for instance. But a lot of people just go through their primary care physicians, and typically they're the main go-to for you. And most doctors are on board with prescribing therapy. A lot of times, if you provide us your doctor's information, we're able to call on your behalf. We just need to get like your date of birth and address to verify your identity. And we can obtain that order for you. But some people will opt to just get that order when they go to the doctors or just give them a call.
Okay, thank you.
Yeah, of course.
Thank you so much. I have a question. I had the foot surgery and I had my physical therapist, but I didn't get better. I'm not able to walk properly. Can I get the new order and come to your facility?
Yeah, firstly, I'm so sorry to hear that. That sounds incredibly frustrating. But yes, absolutely. You can get another order and we can take a look and see what's going on and definitely see if maybe some different approaches or more aggressive therapy or just therapy tailored to what you need right now is going to help you. So yeah, absolutely.
Okay. Thank you. I appreciate it.
Of course.
I do it.
Can you address different things at the same time? Like, okay, I want balance, but I also have a knee problem in one knee, and I also have a spinal problem. Can you address all three things at the same time, or does it have to be one at a time?
That is a fantastic question. And yes, Miss Murtha, is it?
Yes.
Yes, absolutely. We can address multiple things. I had somebody come in recently who wanted to address their shoulder, both of their knees, their hip, and their ankle, and their back all at once. And in a case like that, of course, I'll be like, let's focus on the thing that bothers you the worst first. However, a lot of times you're going to get a lot of overlap. So if you have hip pain or back pain, for instance, and you want to work on your balance, those two are going to complement each other incredibly well because we're going to work on your hip strengthening, which is going to help your balance, your back pain, which is going to help your balance. So yes, absolutely, we can treat more than one condition at once. Now, if it's a case where you have like a hand problem and a foot problem, we may want to work on one at a time because those are two completely different things, but that's not a problem. We can always just start with one and then work on the other. But typically balance can go hand in hand with anything. And balance is something that we try to work on with almost all of our clients, regardless of what your diagnosis is, simply because it's something that a lot of people have issues with.
Okay, thank you.
Of course, hopefully that answered your questions.
Great. Thank you for presenting this to us because I know I'm going to sign up.
Well, thank you so much for being a part of it, and hopefully this information was beneficial. I'm super excited for this opportunity to work with the Senior Center. I've heard so many good things, and I just think that this community around the Decatur area is such an incredible community of seniors that support each other, and truly, I think it's wonderful. All of the amenities and things that you guys have available to you in this community.
Right.
Really honored to be a part of that. Definitely hope we can help as many people as possible.
I think once they get the center open, everybody's gonna feel better.
I think so too. I can't believe it's been 2 years, but
Yeah,
hopefully in March we'll be able to.
but anyway.
Thank you very much.
Okay, thank you, Lacey, and thank you everyone for coming. We will see y'all soon, hopefully in person.
Great
Hopefully.
job. Great job, Lacey.
Oh, thanks, Joanne. Good to see you.
Bye. Y'all have a good rest of your
Bye.
day.
Bye.
Thank you.
Thank you, everyone. Take
Bye,
care.
Valerie.
Okay.
Bye.
Thank you.